This video will cover acute megakaryoblastic leukemia. Let's start by talking about our anchor for this one. Since this is a type of AML, we have our symbol for AML, which is an amulet. Since if you were to shorten the word amulet, you could get to AML, right? This character here resembles a certain character from a famous TV show, doesn't she? Well, Meg here from Family Guy will help us remember megakaryocytes. The fact that she is up to no good and doing some type of explosion or blast will remind us of megakaryoblastic. Now that we're anchored, let's talk about the characteristics of this leukemia. More than 50% of blasts demonstrate megakaryocytic differentiation. To remember this, all we have to do is notice the potency of her explosives here. This leukemia is associated with mediastinal germ cell tumors. Our prompt to remember mediastinum is a silo, but not any silo. A silo full of meat, because meat silo kind of sounds like mediastinal. I can only imagine the smell in this scene. Let's move on. This is reminding me of autopsies. We've used the Germ-X bottle in past videos to represent germ cell tumors, and we'll do the same here. So the Germ-X bottle in this image combined with the meat silo is going to bring us to mediastinal germ cell tumors. One more point to remember about the association of this leukemia with mediastinal germ cell tumors is that both neoplasms tend to demonstrate isochromosome 12p. Okay, so the symbol for this one is simple. Doesn't the word well sound like the number 12? And since the wells are chrome, we're going to remember chromosome 12, since chrome is our symbol for chromosomes. Also, there's two identical wells, which is going to remind us of isochromosome. When AMLs or transient myeloproliferative disorders occur in patients with Down syndrome, they most often take the form of this acute megakaryoblastic leukemia. Our prompt for Down syndrome is a goalpost in a football field because touchdowns are scored in the end zone here next to the goalpost, right? And the word touchdown is similar to Down syndrome. Down syndrome associated AMLs arise typically at an early age between 1 to 5 years old. This matches exactly the demographic of players who will be playing in this field today, which are 1 to 5-year-olds. The last point to remember is that Down syndrome-associated AML shows increased chemosensitivity, particularly to methotrexate, and has a relatively favorable prognosis. To help us remember methotrexate, just notice the screen back here displaying some type of matrix code. Doesn't matrix sound like methotrexate? Since the prognosis is relatively favorable for these Down syndrome patients, we have our character here with a mild smirk. The fact that she's not angry or sad will help us remember a relatively favorable prognosis.